Thank you very much. Give me this opportunity for the interview. Yeah, there is so many exciting news or progress for CD7 CAR T therapy for treating refractory relapse TLL, LBL patients over the last 5 years. We are very much get very encouraged. However, so far there's still no commercialized products available yet. Certainly, first we have to identify a few of those very good products to push through the clinical trial as quickly as possible. So bring those products to be commercialized in order to available for our patient treatment. I realize this is certainly there is some challenge but again, this is the first step. Once the products become commercialized, then we also really need to get their price down in order for more our patients able to affordable worldwide to receiving those CAR T therapy. Certainly many companies working on that, including some of the company working on, for example, universal CAR. Once that get approved, may be able to significantly cut down the cost, and the other company even working on in vivo CAR T. All those are potentially can cut down the cost and make the CAR T more widely available. And certainly there's still a room for improvement. Currently CD7 CAR T for treating TLL, LBL, majority of those patients still need consolidation, allotransplantation. We certainly hope eventually in the future, if the CAR T products get continue improved, question is raised, can we just treat this group of patients with CAR T alone without need for any consolidation, subsequently allotransplantation? But again, still a long way to go, and there's many challenge, but we have confidence this CD7 CAR T therapy will getting better and better, and will soon become commercialized available. For universal CAR T therapy, again, each of those actually modification is essential. And for example, for the CD7, you do need to knock out the CD7 to avoid fratricide. Without this step, the CAR T may have too much of those fratricide, may not able to have good efficacy or whatever. For TCR knockout, really you need to have that step 2 to prevent GVHD and HLA class 2 knockout. So I think there's really not the most important whatever. I think for universal CAR, those are still all very important for the CAR T products to be effective for clinical setting. Yeah, sure. We all hope after CAR T, that's it. No more other treatment, then we can cure patients. But realistically, especially at this point, especially for CD7 CAR T treatment, not yet there. Actually, as a matter of fact, for CD19 CAR T treatment for treating BALL patients for adult, still, majority of those adults still require to have a consolidation transplant. For pediatric patients, then there's a lot of data already out for lower risk patient, or if you have a patient CAR T product able to persistent longer in vivo, those patients may not need to have consolidation transplant. They're still doing well. For adult situation may be a little bit different. For generally speaking, for TLL, LBL, their disease characteristic, they are so aggressive. Especially once they become refractory and relapse, they generally speaking appear to be more aggressive than the BALL. So that's why the CAR T alone still not able to sustain the long-term duration remission yet. But again, who knows, maybe in the future, while we improve the CD7 CAR T, the quality, that's we hope eventually that we can have part of a patient without needing to have a consolidation transplant. Yeah, this is a very, very critical question and critical point. There's a lot of active, investigation in this area, and it's hard to bring out one most important biomarker or whatever. There's a multiple thing can affect the outcome or able to some kind of a predicting the outcome. Okay, for example, often we use is whether those CAR T can persistent in vivo longer after the infusion. Other is whether the antigen density will be high in those tumor cells, and also the phenotype composition of those CAR T infused, okay, may also predict or infect the outcome, or once you infuse the patient, whether the patient have a good expansion or not. Others certainly, such as if you have very poor clinical feature, high risk feature, and if you have a high leukemia burden, all that can kind of predict how well patient going to do after CAR T therapy. Again, we hope eventually in this active area research we'll get more information. So tell us more, even we can predict more accurately.